Okay, so getting the urine off of the skin as quickly as possible is extremely important, and it's something, and that's why we check our residents at a minimum every 2 hours to make sure that we're helping them out there. But one thing that you have to watch for is a lot of these little old ladies will try and hide it. They will try to trick you all day long into thinking that they are continent and they go to the bathroom on their own, they're not having any issues. But because it's embarrassing for them, they won't tell you. So sometimes you have to just have an acute sense of smell, because sometimes they need help cleaning up and they don't want to admit they have a problem. So you just have to be extra cautious with your residents and make sure you're always paying extra attention. So we need good skin care, dry garments, dry linens, and again, we need to promote normal urinary elimination. Okay, if they need to go, let's try to get them as feasibly quick as possible. We also sometimes use what is called bladder training. Okay, sometimes we have residents who lose feeling kind of in their bladders, because for you and me, our nerve endings in that area work just fine. So when you have to pee, you feel the urge to pee, right? Well, a lot of people when they get older lose that sensation and have no clue that they have to pee, and all of a sudden they just leak, right? And they're like, wow, don't even know where that came from. Okay? So sometimes we try to take them to the bathroom on a very rigid, regular schedule. Maybe it's every 3 hours that we sit them down in the potty no matter what and make them try to pee. Okay? And what that does is that trains that bladder to wait every 3 hours or whatever to go to the bathroom. And that helps the patient be less incontinent. Okay? Then sometimes we have to use catheters. We try not to if possible, because by inserting a catheter into the urinary system, you have a direct line for germs to crawl up through all the way to the bladder to give them urinary tract infections and bladder infections. Okay, and you will have increased UTIs if you use a catheter. So we try not to if possible, but sometimes, especially if your patient has skin breakdown, maybe they have a pressure ulcer on their bottom. Well, getting urine on that skin and on that pressure ulcer could be very devastating for that wound and make it worse. So sometimes maybe we're going to put a catheter in for a while just to keep that wound clean from infection and to keep it from breaking down further from the acidic urine. And also, sometimes we have incontinence products to help keep the person dry. I have seen a commercial for a new one, and it's like a cup that you fold up and put up and let it go, and it's supposed to catch the urine. Kind of like, I've heard people using something similar to that for periods. It catches, instead of using like something to absorb it, it catches all that, and then when you go to the bathroom, you pull it out and it lets all the blood flow. Well, this would do that for the bladder, for women's bladders. I don't know all the specifics. Yeah. So anyway, that's a newer product for me. I've never seen it or heard about anyone that has used it to see if it works or not. But that is something newer that they're trying to use for incontinence. So incontinence sometimes is linked to abuse, mistreatment, and neglect. So the one thing you do want to remember is that your resident can't help it. Okay? They really don't want to be incontinent. It's very embarrassing, and again, it makes them stink, and they know it. So just remember, it's really not their fault. So don't try not to get upset with them. But if you do have a certain patient that's driving you insane, like if they're refusing to go to the bathroom or whatever, just talk to the nurse to try to get a fresh person in there to try to help. But again, the person has the right to be free from abuse and mistreatment. And that's what sometimes we think about nursing homes, and people sit around wet and dirty and smelly and nasty, and that's not the impression you want to give for your patient. Now, If you have patients with dementia, sometimes that can bring on a whole new set of problems with incontinence. Okay, sometimes you have to be a detective because you'll go into their room and have these weird smells and you have to track down where it's coming from. Because they may go to the corner of the room, pee in the floor. Worst case scenario, they have peed on a heater and let that heat blow through, and it's disgusting because then you can't remove the smell out of the room forever and ever. They hide diapers and different incontinence products and the pads stuff. Sometimes they'll hide them, and they'll hide their clothes, and you know, you really have to kind of put an extra eye on them and really watch them, because again, they just aren't thinking clearly, and they will do things that we, you know, would never do, but sometimes they can't help it. Okay, now the catheters, when a nurse inserts a catheter, it is inserted into the urethra, which is the tube that connects to the kidneys, the bladder, and things like that. Kind of goes through the system there. So you have the urethra that has a tube inserted into it that will be connected to a drainage bag. Now, a straight catheter would be something that we don't hook a bag to. Okay, if you have a straight catheter, you put the catheter in attached to nothing, but you just use it to collect urine. Okay, and sometimes we're going to use a straight cath for people who maybe are paralyzed, but they want, and you can actually do bladder training that way. Like, they won't be incontinent as much if you like put that catheter in every 3 hours. Okay, it'll drain the urine out, and that kind of trains their bladder. But as a nurse, one of the main reasons I use this is to get clean, sterile urine samples. Okay, when doctor suspects a urinary tract infection, if you collect urine in a normal way, it goes through a pathway that has more germs on it, gets towards the outside of the body, which is covered in germs. And so you get extra germs in that sample that really aren't in the bladder, which is what we're wanting to find out, but it's actually on the outside of the body around the urethra. Okay? So if the doctor wants a true sterile sample to find out only what kind of germs are in the urine in the bladder, then we have to straight cath them. And we'll get that sterile urine out, send it to the lab so they can truly determine only what germs are actually in the bladder. Now, an indwelling catheter, or what most of the time you hear it as a Foley catheter, is a catheter that stays in all the time. It's held, you know, we put water into the balloon, a little balloon in there to keep it from coming out, and it is attached to a bag. So again, when we talk about catheterization, that just means, you know, the nurse is inserting a catheter. Now, again, you see them a lot of times before, during, and after surgery. For someone who is too weak to get up and use any type of commode or toilet. Again, we talked about wounds. We use them a lot when someone has some type of wound, because the coccyx area and the buttocks area is a prime target for most pressure wounds. Now, if there's some sort of process going on that we need to measure their urine hourly, this is a lot easier on the patient, so sometimes they will use a catheter. And then again, sometimes for diagnostic purposes. So it is inevitable that you will have patients that have catheters. So the closed drainage system is what we use for indwelling catheters, and all that means is that the bag is attached to that catheter. There is nothing in between that. So that way no germs can come into the bladder through the catheter. Okay. Most of the time you're going to see these big bags that we hang on the side of the bed, but occasionally you will have patients who like to feel more normal, and they might use those big bags at night because they hold a lot more urine, but during the day you may switch that out into what we call a leg bag, which is significantly smaller, but you can put that leg bag on the side of your leg, and it has little elastic straps that hold it in place. And you can actually put like pants over it. maybe loose pants or something, and walk around and you look normal. And nobody can see that you're actually wearing a catheter and a catheter bag, okay? So that's something that's better, especially for more mobile patients and your younger patients and things like that. So the drainage bag is always kept lower than the bladder. Why? It says to prevent UTIs, but why is that? Exactly. If you hold that bag higher than the bladder, all that urine that has come out goes right back into the bladder, okay? And so you have a lot more incidence of urinary tract infections that way, because the rest of that other urine's been sitting outside the body, churning up some good new germs and whatnot, okay? So that's something you never want to do. You have to be mostly careful about it. You wouldn't do that when you're walking somebody probably, but when they're laying in bed and you go to pick up that urine to maybe empty the bag or something, you can't bend over, pick up the urine bag and start undoing it and things like that. I mean, most of the time it's when they're laying in bed that you'll probably have the worst luck doing that. Now, accidental disconnect. If the catheter becomes detached from the catheter bag, which could happen, especially like maybe you accidentally stepped on the bag while you're walking them and then all of a sudden, bloop, it comes undone, okay? If that happens, of course you're gonna tell the nurse at once. Make sure you don't touch the ends of the catheter or the catheter bag, because we don't want to put new germs into a system. You're gonna wash your hands, put on gloves. We're gonna wipe the end of that tube with an antiseptic wipe. We're gonna do it with alcohol. So we're gonna kill any germs that might have gotten on the ends of those tubes, okay? So you're gonna wipe those down, both ends, and then after you've cleaned them, of course, you're not gonna retouch them, but you are gonna connect the tubes again, and one just slides into the other. It's not a big deal, and I'll show those to you here in a little bit. We're gonna put the alcohol pads into the biohazard bag. Why? Right, because you have used that on body fluids. So when we talk about biohazard stuff, that anything that would have any type of blood or body fluids on it, we don't mess with. So we throw anything into the biohazard bag. And then again, after we get done reconnecting it, we're going to take our gloves off and wash our hands again, just like any other process we do. Now the leg bags are changed to drainage bags when they're in bed. They're not going to hold a full night's worth of urine. They're not that big. So make sure that you open the closed drainage system to prevent any kind of germs from getting into the catheter. And then at the end of every shift, you're going to empty that drainage bag. You're going to measure it in those kind of graduated cylinders. Because at the end of it, there'll just be a little, there's several different drainage bags, but there'll be a way to open it. It drains right out into that graduated cylinder. You're going to note like how much is in there. And what else are you looking for in that urine besides just measuring it when you're doing input and output? Particles. Clarity. Odor. Color. Great. Great. So, always measure if you change from a leg bag to a drainage bag or vice versa, or if that leg bag or bag in general is becoming full. Maybe they had a lot of, a lot of these patients get swelling and things, and they'll take what we call a diuretic, okay? A diuretic, or they call it a water pill, okay? Basically makes water come out of their body through their urine. So if you've got someone with a bunch of swelling things going on, they take a bunch of diuretics, that bag can get it full pretty quick after they've taken that, because it kind of forces your body to get rid of that extra fluid through the urine. Now, condom catheters, we don't see that often. They might also be called a Texas catheter, and basically what that is, it looks like a condom. Obviously it's a lot thicker and more, it's a thicker type of kind of rubbery condom that goes straight into a catheter, okay? And you would connect it just like anything else. but you're always going to follow the manufacturer's instructions. You guys can put these on because this is not a sterile procedure like putting a regular urinary catheter into the urethra, okay? Because if you're putting something straight into the body, that's always a sterilized process, and nurses have to do that, but you guys actually could put these on. So of course you're gonna read your instructions on the kit, you're gonna wash your hands, then you're gonna wash and put on gloves, you're gonna wash the penis, because only guys can use this obviously, with soap and water, dry it, and then the condom catheters themselves will adhere, but just make sure you never touch adhesive tape to secure the catheters, because when you're trying to take that adhesive tape off, what's going to happen? Rip the skin, and your patient will not be happy with you because it will hurt like a mug. Okay, so again, we talked a little bit about bladder training. We're trying to help control that bladder. We don't want them to be incontinent. So if you can sit them up, sit them on a toilet, whatever you can do, then we want to do that, because the more normal they feel, the more normal the better their bladder will empty. Give them as much privacy as you can. And I realize that some of your patients are such a high risk for falls that you can't. But if possible, at a minimum, close the door and stand outside the bathroom. Give them their privacy. Make sure that you know the 4 methods, okay? Bladder retraining, where you're trying to resist the urge and you follow a schedule instead. So, okay, well, I feel like I have to pee, but I've got 30 more minutes until my schedule, so I'm going to wait right now, okay? Then you have prompted voiding, which means that the person uses the toilet at certain times. You have habit training or scheduled voiding, where it's scheduled usually every 3 to 4 hours based on their normal pattern. And then you have the catheter clamping, which means they have a normal catheter, which we've talked about, and what we do is we clamp it off and allow, because when you have a catheter, that urine's draining constantly. There's never any urine that actually sits in the bladder. But if someone has had a catheter for a long time, and we're going to have to take that out, and they're going to have to start peeing on their own again, they may need a little bit of this training before we can wean them off of this catheter. So we clamp it up, and we allow that bladder to fill. And then maybe every 3 to 4 hours we go and empty, take the clamp off, empty out all the urine, clamp it back up, okay? And that just kind of reminds the body of, oh, here's that urge again to pee, and now my bladder's getting used to stretching out again and doing things. So sometimes we'll use that catheter clamping. Now again, illness, disease, age can always affect how people are able to use the restroom. So residents often need our help in assisting them with their elimination needs. So we want to make sure we can just promote their dignity as much as possible. It is very embarrassing for most of them. Try to make them as comfortable as possible. Respect when they need help with elimination needs, because it's always going to happen at the time that you're in the middle of doing something. It always happens that way. They never pee on your schedule. It just always happens. But try to respect that. And, again, try to protect their privacy as much as possible. Even if it's just turning around, try to find some way of not sitting there watching them use the restroom, okay? Make sure you're emptying your urinals, your bedpans, your commodes ASAP, because you don't want their room to smell like urine. When a family member walks in and smells that, what do you think is going through their mind? They're not taking care of my mama. And you think they're not going to be mad? You're wrong. Because, you feel the same way if it was your mama, right? Okay, any questions?